Hi, my name is Naida Maslik. I'm a student here in Nightingale College. I'm here to do a educational um, for a patient. First, I'm going to wash my hands, hand hygiene, go ahead and give my patient privacy, introduce myself saying, hi, my name is Naida Maslik. I'm going to be a nurse. She gives me her full name, date of birth, MRN number, and then I go ahead and talk to her in regards of the education for pregnancy. So first things first, we need to avoid what we need to talk about. Pregnancy, they should be avoided for the first. We need to talk about mercury. This occurs in fish like tuna, sushi, stuff like that, which you want to stay away from because it can cause birth defects. Second would be undercooked poultry meat. Anything that's undercooked meat can cause illnesses and also cause damage to the baby if those bacterial microorganisms were to get to the mother. It would just completely hurt the mom and the baby. Unwashed produce you can get is like E. coli, which also the baby could get. We want to educate the mother on over-the-counter supplements, medications that can be used, and those to avoid. So the mother can take Tylenol for pain, otherwise known as acetaminophen. Tums for heartburn are okay with Claritin because it's the first second generation, and histamine. Some antihistamines are okay and some are not. Claritin is the one that is okay. And then supplements, we want the mother to take our folic acids to prevent neural tube defects, and then prenatal vitamins such as calcium, iron, to go ahead and help with possible anemia. We want to go ahead and discuss environmental exposures that the mother should avoid while pregnant. First would be avoiding clean chemicals. They can really harm the fetus and cause birth defects. Second would be secondhand smoke. That can also be a huge problem for the fetus and also a problem to the mom. The third one would be pesticides. This can be cause severe damage to the fetus, such as birth defects, and which can lead also some issues to the mom as well. The other ones that we need to discuss is alcohol and tobacco intake. Alcohol is not safe for the baby, and it can completely cause brain damage, birth defects, fetal alcohol syndrome, and it can also cause mother to miscarry or have preterm birth. Tobacco you want to avoid, especially can cause effects in the mouth and lips. It can do worsen preteen birth, lower birth weight. It can also do miscarriages or loss of fetus for the mother, as well as overall just stay away from alcohol and tobacco while you're pregnant. Especially other drugs like recreational drugs are not good because they can cause brain damage. The baby, especially while the brain's being developed. Brain defects. Um, uh, Discuss traveling precautions while you're pregnant. Generally, it's pretty safe to travel, but it should be done before the third trimester, just in case anything happens, like preterm birth or anything like that. Of course, always wear your seatbelts. Swelling is often occur when traveling, so loose clothing, loose shoes is the best for you. Usually, some ankle swelling, edema down. Um, it's normal. It's something that happens, but to prevent DVTs, walking around will be helpful while traveling. Stay away from fresh produce stuff that's overseas. Like I said, E. coli is usually something that can happen and you can consume it. Hot or prepackaged foods are safe, and bottled water for prevent illnesses or transmission of bacteria if you're traveling overseas, especially if you're doing like foreign countries. I mean, there's a lot of different illnesses, very uncommon, but you can still get that. You want to meet with your provider prior to traveling to make sure that there's no vaccines you need on a precautionary things that you have to go through with the provider. Most airlines do not allow pregnant women to travel after 36 weeks, just in case preterm labor. We also will want to discuss going to the dentist. It's usually safest in the second trimester. Just don't do any x-rays or procedures or anything like that. You wouldn't want to expose your brand new baby fetus to x-rays. So usually you want to wait till the second trimester, and for any dental pain that you have. Most medications aren't really good for the fetus, but like I said, pain medications such as Tylenol is often what is prescribed for dental pain. And then if you do need a procedure, it's usually best if you can wait until after you deliver. And then that will conclude my video. Thank you. Hand hygiene. Ask my patient to see if she has any questions. She has no questions. And yeah, that's it.